Almost 10% of women experience excessive vaginal discharge, which is not normal. The majority of such a discharge is because of infection. Also, there are several important causes which we should never ignore because they may be a sign of a serious underlying cause. We will discuss the top 7 types of discharges and their causes.
The most common discharge is normal, which is clear, odorless, maybe slightly yellowish, but when ovulation occurs, it becomes more egg white, like clear, slippery and stretchy. Now, let's say what is not normal. If the discharge is more white grayish and smells like fish, worsens after sex and has no itching, it is most likely bacterial vaginosis.
The treatment is with metronidazole. Bacterial vaginosis develops because the vaginal microbiota is disrupted. Instead of lactobacilli, which is normal, Gardnerella vaginalis growth, which is pathological. This bacteria is anaerobic and produces amine compounds which have such a fishy odor, noticeable after sex. When the discharge is white, more thick, cottage cheese-like, with no smell but itching and a burning sensation and redness and swelling of the vulva and vaginal walls, it is a Candida infection, also called a yeast infection. Candida is a fungus and it grows when the normal vaginal microflora disrupts, for example after antibiotic usage or a weakened immune system, diabetes, HIV stress, or tight, non-breathable clothing, which traps moisture. The treatment of Candida is fluconazole, 150 milligrams orally, a single dose, or clotrimazole or miconazole vaginally, creams or suppositories for 7 days. If the discharge is more mucus-like, pinkish, slightly bloodish, especially after sexual contact, it is most likely cervical ectropion. It happens due to cervical sensitive tissue damage. It causes postcoital spotting and mild pelvic discomfort. Ectropion is more common among young women if no important symptoms are present. It doesn't require treatment. If it causes symptoms or recurrent bleeding, then cryotherapy or electrocautery may be used to remove the exposed glandular cells in severe cases. The 4th most common cause is sexually transmitted diseases like chlamydia, gonorrhea, and trichomoniasis. Chlamydia and gonorrhea cause a yellow-green, thick, pus-like discharge. The odor may be mild, but can often there are no symptoms, a possible pelvic pain, burning during urination, and abnormal bleeding.
During trichomoniasis, also a common condition. There is a greenish-yellow, frothy, bubbly discharge which has a strong, foul, musty odor. Intense itching and burning are common, especially during urination or sex. Trichomonas is not bacteria but a single cell parasite. The problem is that chlamydia and gonorrhea, both of these bacterial infections, can ascend into the pelvic organs and cause pelvic inflammatory disease called PID. If left untreated, PID is a major cause of infertility.
Chlamydia treatment is cetirizine, 1 gram orally. A single dose. For gonorrhea, ceftriaxone intramuscular, 500 mg, a single dose plus azithromycin, 1 gram. For trichomonas, metronidazole, 2 grams orally, a single dose, or tinidazole, 2 grams orally, a single dose. The 5th common discharge is due to endometrial hyperplasia and fibroids. A woman in her late 30s to 50s notices dark brown or black vaginal discharge, often with small clots. She may have experienced heavier and prolonged periods over the past few months, possibly with irregular cycles. Sometimes she also has spotting between periods.
Endometrial hyperplasia is when there is excessive proliferation of the endometrial lining of the uterus. It happens most commonly in perimenopausal or postmenopausal women, particularly those with risk factors such as obesity, polycystic ovary syndrome, and estrogen therapy without progesterone. Such hyperplasia causes heavy and prolonged menstruations, irregular bleeding between periods, and postmenopausal bleeding. The volume of the discharge is variable, but typically light to moderate. The discharge can be dark, making brown or black discharge more noticeable after sex.
And now let's discuss when discharge is a sign of a serious cause like cancer. It can be a sign of cancers that affect the cervix, endometrium, vagina, or ovaries. Cervical cancer is the most common, which is associated with abnormal discharge. Cervical cancer discharge is watery, pinkish, brown, or foul-smelling. It may contain blood streaks. It often occurs outside menstruation and is common in women aged 30 to 50. It is also associated with persistent lower back pain. Risk factors are persistent HPV infection to papillomavirus. Smoking weakens the immune response to HPV. And long-term birth control use, more than 5 years. Endometrial cancer risk usually increases after 50 and is associated with obesity and diabetes. Vaginal cancer risk also increases after 50, as does ovarian cancer.
That's why to exclude a serious cause, when there is abnormal bleeding, especially any postmenopausal bleeding, investigation is required. For cervical cancer screening, a pap test, colposcopy, and biopsy are used. For endometrial assessment, the best initial test is a transvaginal ultrasound, which measures endometrial thickness 4 mm postmenopausal is concerning. A pelvic ultrasound also detects ovarian masses or fluid buildup.